what are the signs and what are the prevention cause, or like what are the symptoms? Like how can I detect, or like how, I would feel certain things. Like what are the signs and symptoms, doctor, so that I can be aware of these diseases.
If the general population knows these symptoms or these signs are I mean the problem he's having, or his family member or his kids or anybody is having, can be due to valvular disease, is very important. So knowing the symptoms and signs of the valvular heart disease is very important. As we have discussed, this disease is very common in young population. That is the kids. The disease starts very early in um, uh, age, at the age of around 2 to 5 years. So knowing the disease at the earliest and preventing this disease is very important. In India, the most common, you can say, the first, if you label the different causes of the valvular heart disease, first 4 5 causes you have to label that is rheumatic only. So knowing symptoms of the heart disease, as far as congenital valvular heart disease is concerned, you have to, if there is any abnormality during birth, a wise pediatrician must screen for the congenital heart diseases, including the congenital valvular disease. So this is the on part of the pediatrician and the treating physician. So this is on their part, so that they can screen the baby for the valvular heart disease due to congenital causes. Once baby is grown up for 2 3 years, if you find the baby is having recurrent throat infection or is complaining of the joint pain, he's limping while walking, you must suspect the baby might be having rheumatic fever. Any baby who is having recurrent throat infection and joint swellings, you must be become alert to screen for the rheumatic fever. So looking for the recurrent throat infection and joint inflammation, or undue shortness of breath, if child become very dyspneic while playing, if child is complaining of very fast heart rate, these are the early signs of having underlying valvular heart disease. You can say late in the life, most of the patient complains of exertional dyspnea, that is shortness of breath while walking or going upstairs. Second most common symptom is palpitation. He feels fast heart rate while working or doing anything. Many of the patients of the aortic valve will have chest pain while walking. They will complain of the engorged neck veins. Their neck vein will pull, and they can see the pulsation and the fullness of the veins in the neck. Many patients can have a dizziness and fall. Many elderly people will come to you with a stroke, and you can the hemiplegia, where one side of the body is paralyzed. The first symptom of the valvular heart disease can be a stroke, because the valvular heart disease causes stroke very commonly, and most of the valve patients have a risk of getting stroke, because clots formed inside the heart. When valve is damaged, there are chances of deposition of the clot. Clot is formed within the heart because the chamber is dilated, the valve is deformed, the inflammation is there. There tendency of forming clot there. Because the heart is dynamic structure, heart pushes this clot into the brain. Once this clot goes into the brain, it causes CVA, stroke. So these are the grossly symptoms of the valvular heart disease in different age groups. So there are drugs to prevent this damage to the valve, if you're able to diagnose it very early. Thank you.